We are moving on. Again, so much stuff we've been talking about this month. All right, so let's get into cardiothoracic surgeons versus vascular surgeons. Big hot topic. Most aortic disease centers offer both, in addition to your cardiologist, in addition to possibly a God, my God, the word just left my head. When you have high blood pressure, what's the word? High, Nope, can't think of the word. But in addition to a high blood pressure specialist, that's not the name. I just can't think of it because it just left my head. And also electrical, um, uh, heart specialists. They have a lot of different specialists in an aortic disease center. So then how do you know who to see? I've been asked before, do you see a vascular surgeon? I do not. And I'm dissected all the way to my iliacs. I've only seen a cardiothoracic. So let's talk about the difference. And this may give you a moment to pause and decide if you are seeing the right person or if you should talk to your physician about adding a specialist, or maybe you have both and you're perfectly happy. I don't know, but I know that these questions are often asked. So let's talk about it. Okay. But one of the things Adam wanted to ask was, what does it mean when an aortic valve is super tight? Do we remember what that means? Ready? Stenosis. And regurgitation was leaking. Okay. Just a review of what we just talked about. All right. Let's compare two amazing types of surgeons that would help treat aortic disease, cardiothoracic and vascular. While the two usually work together to help repair aneurysms and dissections in the aorta, their expertise, their training, and common surgeries are very unique in their approach. Okay. Let's start with the cardiothoracic surgeon. These women and men are our beloved heart specialists. They specialize in surgical repair of diseases affecting the heart and lung. Thoracic, that's going to be anything diaphragm and above. Again, heart, lung, anything that's going to happen in the chest, this is their specialty. This is what they've been trained to do. They complete medical school before starting residency, and during residency, these surgeons train to learn general surgery procedures followed by cardiothoracic surgeries, which focuses specifically on surgeries of the heart and lungs. And a good rule of thumb is that their main area of operation involves the chest organs and the surrounding blood vessels. Okay. Common surgeries that are performed by CT surgeons include coronary bypass, valve repairs, heart and lung transplants, and of course, aortic aneurysms and dissections. They're going to be handled by cardiothoracic surgeons. Now, if we talk about vascular surgeons, these women and men are vascular. They are vessel specialists. So that means their focus is treating diseases of the entire vascular system. This includes both arteries and veins throughout the entire body. So these include vessels that might be near or in the stomach, in our limbs, and of course, vessels of the heart, such as the aorta. Sounds a little confusing because they're pretty similar, right? And so similarly to a cardiothoracic surgeon, they complete medical school and sometimes spent learning general surgery. However, they go on to actually train in vascular surgery, and this emphasizes the surgical treatment of vessels throughout the entire body. Not like super large vessels like the aorta. We're talking veins and smaller, and they're tiny. And I would envision them typically using the microscopic goggles all the time. The difference between a vascular surgeon and a cardiothoracic surgeon is that vascular surgeons may find themselves operating far away from the chest, and that might be an artery in the neck. It could be blood vessels from peripheral trauma, maybe a limb injury, carotid artery disease in the neck, something like that. It's going to be farther away from the chest. But when it comes to aortic health and CT, the CT and vascular superheroes often team up to diagnose and treat dissections and aneurysms. So this means that after you've had a CT scan, an echo, MRI, all of those results come in, they may actually together review your images and kind of make the decision the best way to repair or to treat what's going on with you. And based upon which part of the aorta actually has the disease or has been impacted, one might find themselves being operated on by a cardiothoracic surgeon, or you might find out you had a vascular surgeon do it. So for example, if you're going to have open heart surgery, If there's an aneurysm or dissection that's needed in the ascending aorta, a cardiothoracic surgeon, they would be able to open the chest safely and repair the areas of damage, taking great care to ensure the great branches that come off of the aorta to feed blood to the brain, that they remain intact. Conversely, for type B dissection involving the descending aorta, further away from the heart, for those traveling down to the arteries of the leg, which would be the iliac, a vascular surgeon would be actually able to smoothly perform endovascular repair and deploy durable grafts to help fix any leakages of an aneurysm. So again, if you have a type B dissection and you're forming aneurysms in or around the iliacs, maybe also the renal glands, your vascular surgeon would be the one to consider deploying that graft we were talking about that can go in, like they put the valve replacement. You can deploy a graft instead of having to cut somebody open a lot of the time. That's an endovascular repair. They would be the ones to do it typically versus the thoracic surgeon, because again, it's further away from the chest. So again, let's talk about type A and type B dissections. Type A, which would be ascending, would be coming anywhere out from the heart and going up the arch. And then type B is coming down. Okay. And this is the DeBakey, I think, that divided it into, or no, maybe Stanford was dividing it into 1, 2, and 3. I can't really remember. But anything you see here in the 1 or 2 type, this would be considered type A. Type B, it started here. So anything that starts here in the ascending is a type A. Anything that starts after the arch comes down, that's a type B. Again, breaking it down to type 1s or type 2s gets a little bit more intricate in detail. Okay, but if you need surgery, understanding the roles of a cardiothoracic and vascular surgeon, it could be really helpful in planning your care if this is going to be a planned surgery. So the important thing is to know that regardless of who you or your loved one actually sees, the teams often work together to ensure that you're getting the best care possible and have dedicated a great portion of their lives to being trained to be experts in their field. If you want more information about cardiothoracic or vascular surgeons, there are links that are here in the post, which was last Tuesday, or it could have been Monday. Could have been Monday, could have been Tuesday. We've been doing multiple posts in each day, but you'll find it on our blog series.